Hi everyone, welcome to Earthbound Health. Thanks for stopping by. Please subscribe to the channel and come back often to get more no-frills, no-nonsense valuable health information. Imagine a world where the sight, smell, or texture of most foods trigger intense anxiety or disgust. For individuals with avoidant restrictive food intake disorder, also called ARFID, this is their daily reality. ARFID, which is sometimes described as selective eating disorder, is a complex condition that goes beyond simple picky eating. Let's see why. So, what is avoidant restrictive food intake disorder? It's a complex eating disorder that involves a severe and persistent failure to meet nutritional needs. Unlike other eating disorders, ARFID is not driven by body image concerns or a desire to lose weight. Instead, it involves extreme food avoidance due to sensory sensitivities, fears of choking or vomiting, or a general lack of interest in eating. ARFID leads to a very restrictive diet, which can cause nutritional deficiencies, weight loss, and social isolation. Both children and adults can have this disorder, and they can be forced to try and get their nutrition through supplements or tube feeding. What causes ARFID? There are biological factors. ARFID may be caused by genetic predispositions and neurological differences in taste or smell processing. Studies suggest abnormal levels of fullness-promoting hormones like peptide YY and low levels of hunger-stimulating hormones like ghrelin could be involved. You also have psychological factors. There are psychological factors. The disorder often coexists with anxiety disorders and autism spectrum disorders. Traumatic experiences related to food, such as choking incidents, can also trigger the disorder. Psychological factors include anxiety and obsessive-compulsive tendencies. You also have environmental factors. Early feeding difficulties, limited exposure to diverse foods, and parental anxiety about feeding can increase the risk of ARFID. Traits such as high sensitivity or rigidity in routines also play a role. What are some signs and symptoms of avoidant restrictive food intake disorder, or ARFID? Dietary restriction is one of the symptoms. Individuals with ARFID maintain a highly restricted diet, limited to specific safe foods. This can include a preference for certain colors, textures, or brands, and avoidance of entire food groups, resulting in nutritional imbalances. You also have physical symptoms. Common symptoms include significant weight loss, failure to gain weight or grow, especially in children, gastrointestinal issues, fatigue, weakness, and in severe cases, reliance on nutritional supplements or even feeding tubes. You also have emotional and behavior symptoms. People with ARFID often experience high levels of anxiety around food and eating situations, avoiding social events involving food. Unlike those with anorexia nervosa, individuals with ARFID typically do not have concerns about body image, but fear choking, vomiting, or other negative consequences from eating food. What are some health risks of ARFID? ARFID can lead to severe deficiencies, resulting in anemia, weakened immune system, osteoporosis, electrolyte imbalances, and potentially severe outcomes such as cardiac arrest and delayed puberty. You also have cognitive and physical effects. Essential nutrient deficiencies can impair cognitive function, affecting concentration and memory. Growth delays are common in children, while adults may experience unhealthy weight loss and muscle wasting. You also have social and psychological issues. ARFID can cause significant social anxiety, leading to isolation and depression. This social withdrawal affects personal relationships and professional settings, creating feelings of loneliness and low self-esteem. Here are natural ways to treat avoidant restrictive food intake disorder. Cognitive behavior therapy, or CBT, has been proven to be effective. This therapy helps change negative thoughts and behaviors around food. A key component of the therapy is to introduce feared or avoided foods gradually to build confidence and reduce anxiety. It also uses desensitizing techniques and coping strategies to help patients deal with food textures or smells they don't like. You also have family-based treatment. This approach especially is useful for young children. It involves educating the entire family about ARFID and developing strategies for meal planning and supportive eating environments. You also have nutritional counseling and mindfulness. Nutritional counseling helps patients to expand their diet and meet nutritional needs through creating interesting meal plans. Mindfulness techniques like yoga and meditation help manage anxiety and create a healthier relationship with food. How is avoidant restrictive food intake disorder different from anorexia? ARFID is a severe failure to meet nutritional needs because the person is avoiding food. It's not because the person is obsessed with body image or weight loss, as is the case with anorexia. People with ARFID may not eat because of sensory sensitivities, fears of choking or vomiting, or they just have no interest in food. They also have severe issues with certain textures, colors, or types of food. Avoidant restrictive food intake disorder, or ARFID, is an often misunderstood eating disorder characterized by severe food avoidance and restricted dietary intake. It's not caused by concerns about body image. Its causes are biological, psychological, and environmental. People with ARFID have a lot of health risks, including nutritional deficiencies and social isolation. But there are effective treatment approaches like cognitive behavior therapy, family-based interventions, and nutritional counseling. By increasing awareness and understanding of ARFID, we can improve support for those affected and provide more effective strategies for managing and overcoming this challenging disorder. Thanks for watching. Please subscribe and return often to get more no-frills, no-nonsense valuable health information.